That's important to point out. So why don't we dive in? There's a number of questions, great questions that came in prior to the webinar, starting the webinar today. A lot of these really are important. So let's start out right away. How can we medically uh, detach or turn off our brains when triggering? Strains, methods. The related question came in. PTSD causes me to have unreasonable fears like crossing a 3 mile bridge. Does cannabis help me to overcome fear? Manny, this is summarizes your situation almost to a T.
Absolutely, it does. So the way I like to describe it is overall, yes, it does assist. It's not a cure. For me personally, what cannabis did, using whatever products I found were beneficial, was help me realize what I was encountering, what I was dealing with, and possibly come to terms with it. Um, However, if you're not too aware of how this is treating you or how to really realize how it's treating you, again, the answer is yes, you will start feeling better. And because you're feeling better, you may be able to come stressors that you normally wouldn't be able to overcome, such as crossing the 3 Mile bridge.
Yeah, I think the answer is yes. I could go into a lot of the technical reasons as to why it medically detaches, but the point is it works, and you're a prime example of that. So I think the answer to that question is yes. Um, Next question is a really good one. You brought it up when you in your testimonial. How much does a card and product cost, and do you accept insurance? I have the related question is I have TRICARE for medical insurance. They sent me a letter. TRICARE would cover my RX for medical marijuana guidance. First of all, here in Florida, you have to go to a medical marijuana licensed doctor and have him diagnose and being able to look at your particular condition and verify to the state of Florida that you have one of the qualifying conditions. That's an important part of this. And that means you have to go to a doctor's visit. And the doctor's visits, the initial ones will run to be able to pay for the doctor and have him be able to put basically his medical stamp on it for the state. It'll cost anywhere, I think, between really 250 and about $350, really averaging about $290. Is that what you've seen, Manny?
That's actually the same thing, and I've also heard, being a veteran myself with TRICARE. I've heard of these. I haven't received a letter yet, but the guidance I've been given as I reached out was that they will cover the license with the state, the 7775, not necessarily the doctor's visit. So to your point, Mark, once you visit a doctor and you get confirmed or you get your recommendation, then you would submit that to TRICARE. TRICARE will cover the license to the state, I believe. That's the guidance I've gotten so far as I've reached out as a veteran.
Well, and they may cover more. We don't know. I think this is a groundbreaking area, and we should really follow it. So whoever brought this question up, I'd like to again find out more information about their experience. That really what you're talking about is a doctor's visit. That's one cost. Then a separate cost is being able to get the actual license, like you get a driver's license from the state of Florida, and that's the $77 you were referring to. So it's really two costs that are there. And I think the more important part is to understand that doctor's visit has to be done a second time during the year because for whatever reason, and again, I'm going to lay this one on Rick Scott. Rick wanted to drive up the cost of medical cannabis so people wouldn't use it, so he required two visits a year. So you need to go through a second visit, unfortunately.
Yep, absolutely. And there was a other part, the product cost, it varies. We have different sales throughout the month, and it also depends on which route of administration, which product you're going to get,
Mhm.
the way it's processed. But you don't have to have a medical card to come into the dispensary to have a conversation with us. If you're that curious and you would like to come in and have a seat and talk with us, we'd be happy to do that with you, so we can kind of approach you the right way and show you how to get started the right way as well.
Yeah. I know that in my particular case, I'm really managing pain and inflammation, not necessarily PTS, but my costs are about $75 to $90 a month, depending on the route of administration that I want to take a look at. Your thoughts on that, Manny? What do you see as about an average?
On average, I see pretty much about the same, anywhere between 75 to maybe 175 on the high end. And then usually it only varies when we're out of stock on something, because we will show you how you can find comparable products, which typically you would have to do as anyway, when that's another subject. But yeah, about 50 to 150, maybe 175 on the high end mark a month.
Yeah. And I do want to point out two things that are really important. Um, Sign up for the email notifications from the dispensaries, for example, from Surterra. You run almost weekly specials, which is great. It's kind of like my wife is what I call the Chico whisperer. She likes to look at all the emails, specials that come out. The same thing happens with Surterra and also with all the dispensaries. You'll get deals that come out that help save money, and then also there are specials that are going on, seasonal specials now that the holidays are coming into play that you might want to be able to take advantage of. So shop wisely can save you significant amounts of money, I mean 25 to 30%. You've seen that with your patients.
100% all the time. We have a lot of regulars that do only shop online so they could pick up a little bit quicker, don't have to wait in the store. They can see what's in store. We're pretty accurate with what's online as well as the discounts as well.
Yeah. The other question is there a medical regime that mimics PTS drugs? I'm going to let you answer this one, Manny, because you've been through this. But again, by regime, we mean how long do you take it? You're going to have to take it something in the morning, evening, in the afternoon, because it's not something that's going to go away. Is that safe to say?
Yes, and it also depends on the what type of product you're taking. So if you're taking, for instance, one of our Theragels, those can last 7 to 12 hours. So you might only take it once or twice a day, depending on what route of administration you're taking. As far as to the question, as far as the medical regimen that mimics PTSD drugs, I personally say no because of my knowledge from what I gather from myself. Cannabis plays on the CB1, CB2 receptors primarily, which is a different playground typically than what pharmaceuticals play on. So the reaction that your body gets, from my perspective, is more natural rather than synthetic. Therefore, I'm able to tolerate and adjust accordingly and more rapidly for that matter when needed, rather than having to fear what chemical imbalance I'm creating with pharmaceuticals. That is not to say that pharmaceuticals are not good. Please don't misunderstand me. I'm not a medical professional. I don't want to be misquoted, but pharmaceuticals are required for a lot of people and for a lot of diagnoses. However, for my particular PTS, I found that cannabis was significantly better.
Sure. And I know in talking to a number of, and you talk to more veterans than I do, and people that have PTS, I have found almost unanimously, or pretty close to unanimously, they prefer the medical cannabis route than the pharma drug route.
I certainly did. I only tried one. I didn't like it. I can only imagine a cocktail of those things. And I was fortunate enough to make the decision not to jump in that pool, and I went the other way.
Yeah, yeah, that's important. Another good question is PTSD considered a depressive disorder that would be best treated using a sativa or an indica? Um, is it a this depressive disorder? Now, there's the medical term, the medical terminology, and then there's of course the terminology in general. I would say it can be depressive. Your thoughts, Manny?
I agree. And as a matter of fact, if you look at the OMMU, Office of Medical Marijuana Use, that shows you which diagnoses can be used, it does say similar and or like
Mhm.
to diagnoses that are qualified, such as PTSD. And some of those similar or like symptoms are depression, anxiety, stress, and there's probably a few others that I can't remember off the top of my head. I wouldn't classify it, again, not a medical professional, as a depressive disorder, but depression definitely falls under the category of PTS or PTSD by definition.
So when it says what should really, when you talk about sativa and indica, you're talking about more drugs that in today's culture, in today's generation of cannabis products, you're talking about leaning, meaning sativa are energetic leaning products, indica are relaxing leaning products, because there really aren't many pure sativa and indicas available anymore. But the point I'm making is it really depends on the individual which route to go.
Absolutely. And then the rule that most people follow is if you're dealing with anxiety, stress, or PTS, PTSD, stay away from sativas. It's going to make you anxious and paranoid. And it's a okay kind of rule, but the reason that happens is because of the two terpenes combined, such as D-limonene and alpha pinene, which create that cocktail, which also happen to be primarily found in sativas. But there are sativas with just limonene or without both of them that work very well for PTS. We have a product in our wellness line called Zen, which is
Mhm.
not a super high THC, but it is a bit higher than norm, which is great for daytime pain, anxiety, stress, and PTS issues.
Yeah, no, I agree with you. Really, relaxing is really the key. As we mentioned in that one slide, PTS, um, individuals or people with this particular condition have trouble relaxing, and indica can help in that particular area. There's a good comment here that was made. It says, most patients don't know about the Move dispensary 72-hour patches. We can treat PTS for 3 days. I have used, and I'm a big fan of patches. I really love the Move patch. The 3-day patch is really, really helpful. I'm not trying to promote products on this particular webinar, although I do want to recommend really good products that can address certain products that are out there. And I recommend the Move patch. I've used it. I think it's a great product, and it really helps with microdosing over 3 days. Now, that being said, Manny, you have patches as well.
We do. We have in our wellness line from high CBD to high THC, from a variation of 12.5 to 1 CBD to THC, all the way up to 1 to 9 CBD THC patch. They're 7 to 12 hours respectively. It also depends on activity and such. And they work great. I don't demonize any dispensary. I'm very familiar with Moves products. I like to pride myself on knowing products on all dispensaries, and I've heard great things about their products. So if they work, absolutely. If you could treat something for 3 days straight and not worry, my hat's off to you.
Yeah, I've used them a lot when I give, especially when I travel and giving seminars and I'm on the road. They've been really helpful. Going on cruises really helps with those particular patches. But I also think the 8 to 12 hour patches help as well. One of the advantages of patches is that you can take them off, which means that after about 20, or if you start having some reaction to them, by taking them off within 20 or 30 minutes, your body basically resets. And really, it makes a case also to why the 8 to 12 hour patches really can help quite a bit.
One of the great benefits, especially if you're not using high THC products during the day because of work or whatever activity you may be in, slap on a CBD patch. Start loading up your body with that CBD to start feeling those effects. So you don't need that high THC as much, more for
Right,
breakthrough.
right, really there. Um, Next question that comes into play: what marijuana products are best for PTSD caused by rape and abuse? Really, the traumatic event can be any traumatic event. Rape and abuse obviously fill into there. I think all the products we talked about really can help with those.
I agree. As I mentioned before, and again, for me particularly, it was more about coming to terms with the traumas that I've experienced rather than trying to fix it with a medication or cannabis for that matter. However, cannabis has allowed me to be able to talk about it, to discuss it, which has helped the healing process for me in particular. So everybody's gonna be different. You might want to start off with high THC rather than high CBD, or vice versa. It's all of a matter of having that consultation so we can get to know who you are, so we can help you figure out what might be more beneficial for you.
And PTS is a condition that's caused by a number of different traumatic events: rape, abuse, loss of a loved one. And again, the war situation. Um, all these products we talked about today will effectively address PTS, and that's what we're really looking for here. Let's take a look at some other questions here that we can dive into. Okay. What terpenes should I look for? Is there a better approach than trial and error to finding the most effective products? And that also has a related question that came in, looking for specific terpenes and strains um, that would help with PTS and also make me more paranoid. We talked about the terpenes. I think the terpene that you really need to be careful of. Let's start with the one to be careful of. I think that's pinene. Your thoughts, Manny?
I'm sorry, I missed what you said there. Which one?
I thought the terpene to be careful of is pinene because it brings back short-term memory.
Yes, pinene by itself and as a number one or number two terpene is quite unusual, but it is out there, and that's the one you want to look out for. Or D-limonene combined with alpha pinene can spark that quite significantly. And as I mentioned, I know it's a broken record, but it's so important. If you're not ready to face that feeling or that effect, it could be a very negative effect that will push you away from cannabis. If you're looking for specific terpenes, most will turn to myrcene or linalool because it's so relaxing, so easygoing. However, if you're looking for daytime products, limonene by itself would be a great starting point to start off with.
Yeah, I agree with that. Yeah, those are good products that help you quite a bit. Next question is: I take a 2-to-1 CBD to THC 10 milligram gummy, and after I feel a bit anxious, self-conscious, should I include more CBD help relax? I think that would really help. I think going to maybe a 4-to-1 or even a 9-to-1 might help. Your thoughts, Manny?
I would agree with that. That'd be the first conclusion. If I had the opportunity to talk to the person, I would ask what products and from where so I could see the terpene profile. It might be simply that these gummies are infused with a certain terpene profile that's inducing that, or it could also be dependent on how long you've started taking them. Your body might be acclimating to the process and figuring out how to react to these gummies. And usually that subsides after about a week. If not, then that's when I would increase your CBD ratio rather than a 2-to-1, maybe a 4-to-1 or a 5-to-1 even CBD to THC. And then we do have as high as 12.5-to-1 or 19-to-1 as well.
I think increasing the amount of CBD really can't hurt you. It can help you, but
No,
I think in this particular case, it will help quite a bit with the anxiety, and that brings on the self-consciousness that you see there. So I think the answer to that one is really yes. Should you continue to take medication previously prescribed along with medical cannabis, medical marijuana, until you are comfortable with change? I would say yes to that. Your thoughts, Manny?
I agree. We always are going to follow the physician's recommendations. If there are no recommendations in there, then we follow the patient's discretionary word because they are the patient and the physician puts this in our hands as patients. But definitely always follow the prescription and then follow the recommendation. If you're confused, your prescription is what you get from the pharmacy. Your recommendation is what you get from the dispensary.
Right. There. Um, let's talk something a little bit interesting here. How to properly microdose while managing PTSD? I think patches work great. I think that's one of the benefits of a patch. And there's also other ways of doing that. Manny, what would your recommendation be?
Patches are my first go-to if you want to microdose, particularly if you don't want any specific euphoric effects. And then we also have our mints, which are 2.5 milligrams, which is considered a microdose. Typically, a 2.5 microdose of THC is going to be slightly uplifting, not energetic, just more uplifting, good for depression. And then we also have our wanna chews, which are the only gummies right now that I am aware of that are homogenized, meaning you could cut them in half and in quarters and have an even titration of medicine
Yeah.
between all four pieces, starting off at 2.5 all the way up to 10 milligrams.
Yeah, and it's very similar to the process that a lot of athletes use. I know when I was playing professional sports, I would literally eat between 5 to 7 times a day, a little bit during the day that was really providing my body the energy that I needed as I went through both the preparation, the performance, and then afterwards the cool down methods. I think that's the same thing. Take those gummies, cut them into quarters. Take the chocolates, cut those up. Use smaller doses of the tinctures and the same thing when if you're using flour, really take less of it, but take it more frequently during the day. Is that a pretty good regime?
I'd agree. I'd agree. And I'd also consider if you're using vapes and you're vaping maybe 2 to 3 times an hour, I consider those micro doses because
Yeah,
vapes or inhalation is fast in, fast out. You're not really absorbing as much for longevity as you would while ingesting it.
right. Next question is a really good one. It's what kind of help with night terrors and sleep and calming thoughts during the day? I think this is where you really want to take a look at some indica leaning products.
Oh,
Your
sorry
thought?
about that. I got muted for somehow. Yeah, so this was really tough for me. What I found for me particularly was using one-to-ones that help relax me and relax my mindset prior to going to sleep. Again, for me, it was I started thinking about I'm like, oh, I'm getting ready to go to sleep. My mind's racing on it. Now it's stuck in my brain. How am I going to get rid of this affecting feeling, this gut feeling, this heart-wrenching feeling, cold sweat feeling? And it took time. It really did. It took me about a week to get adjusted. As I mentioned in my testimonial, I was paranoid at first because of my background. I had to get past that. Once I got past that and realized it was helping me and coming to terms with that, that's when I was able to sleep a little bit more normal. However, if we, as before, if you need to jump right in something to get you to sleep so you can start getting that well needed rest, we do have something called 1-to-9 Dream, which is in a tincture or Theragel forms, which helps that racing mind subside. And that's through using the natural terpene profiles that are in it.
Yeah. And I think a lot of the dream product, as you mentioned, it has to do with the terpene profile. That's a very good product. I recommend it. I've used it. and it really is something that made a big difference. Great question. What products should be avoided?
So in respect to what I was saying about Soothe one-to-one ratio, we also have a one-to-one Revive ratio that I kind of steer patients away from initially until we get them acclimated to using cannabis products. And the reason I do that is because Revive one-to-one has that specific terpene profile that's high in D-limonene and A or alpha pinene. And just about everybody who started off with that always came back saying, how it was too energetic, too overwhelming, even though it wasn't a high THC product.
Right.
So that's one I would avoid starting. Not to say it won't be beneficial somewhere down the line. We just want to get you acclimated and situated first. Other than that, any other product with high limonene and alpha pinene, I would steer clear of initially.
Right. And this goes to the question that talks about the opposite end of that spectrum. What is the most recommended form to maintain the peace and the calm? And I think, has research shown any particular method more helpful than others? You know, inhalation, ingestion, edibles, sublinguals. Manny, I think this really depends on the individual, and more importantly, what they're comfortable taking.
100%. What I found though is if you're open to inhalation, whether it's vaping or smoking, you want to go twofold. You want to use a vape or an inhalant, if you will, as well as an oral sublingual or edible. And what this does is when you inhale, it's breakthrough. You're mitigating or resolving that issue right then and there. But that's not going to last very long. It's going to last maybe an hour to an hour and 45 minutes, depending. So within that hour, you want to ingest something along the same terpene profile or the same product line. So that way, when that vape starts wearing off, that ingestible starts kicking in and it lasts 4, 7, 8 hours, depending. And you have, without any interruptions, peace, if you will, like I like to describe
Right.
it.
Right. And I think it's important for people to understand mixing and matching the different routes of administration are really important. Let me give you an example. When I wake up in the morning, um, I can wake up in a level of pain of between a 7 or an 8 because of the herniated discs in my neck. I take a vape pen. First thing I do is I grab a vape pen and I take 1 or 2 hits off the vape pen, which gives me the immediate relief I want. I want to get that level of pain down to as close to a 1 as possible. But then right after that, I'll take some tinctures. I typically take a 4-to-1 tincture because what that does is it helps relieve the inflammation, helps relieve the pain. By putting them together, the vape works right away, but the tincture will last between 4 to 6 hours. So what I'm doing is I'm working in a combination of something that will take me, for example, into the early afternoons where I'll take my second regime. That's mixing and matching is important too.
100%. And you can even go one further and use the trifecta. Is some people who say, for instance, you were in a car accident and the chronic pain that you're dealing with keeps on giving you those flashbacks. You can use a topical, an ingestible, and an inhalant to help mitigate that pain so you're not reminded of what you've been through so much. It's all about the combination. It's all about figuring out what works for you individually. And that's what we're here to help you do.
Right. A really good question that is appropriate here is can marijuana heal the brain from trauma or just manage the symptoms of PTSD? And is CBD or THC better at that? Manny, this is really right up your alley.
I don't like to say that marijuana heals anything. So I will go here and say that it will help manage symptoms of PTS and PTSD. And it depends again on the trauma and what you experience or your reactions to your trauma, whether CBD or THC or both are going to be better. Typically, it's going to be both. We like to always aim for the synergistic or entourage effect of having your cannabinoids, your trichomes, or excuse me, your terpenes, your flavonoids, your whole spaghetti and meatball dish, if you will, with your favorite sauce. That way you can really enjoy it, get the effect you're looking for, and feel better. You got to come in, get that consultation, or just have a conversation with us, and we'll get you there.
Right. And I think that one of the things that cannabis does is it works with the receptors in your body. And if you have a receptor that's overfiring, which is what causes a lot of the problems that we see, including trauma, what it does, it calms those receptors down. So I'm not using the word healing. What I'm using the word is the right word you use, Manny, which really you're managing it because you really got to be able to manage that particular receptor and really get it to act as normally as possible. Now,
Now,
the next
that's not to,
question, go
I
ahead.
was just going to say, Mark, that's not to say that if your trauma or your flare ups or your triggers don't come back anymore, are you healed? or are you able to manage it now so you no longer need medicine? Are you healed? So that's why I don't say healed. That's all. That's
Right.
a part of the personal journey you're going on as well, I believe.
I think you're exactly there. It's not going to go away. What you're doing is you're managing it. I think that's the important thing to understand here. Is it can flare up at any time. Best way of putting it. Manny, next question is: hasn't the military recently admitted the benefits seen by veterans when use is allowed? I know they've just started a study on cannabis. Your thoughts, Manny?
There's been studies for cannabis for quite a while now in the military. I forget the names. It won't come back to me on this session, but they actually, the one gentleman fought for the right to where the government would provide him with marijuana joints, as a matter of fact, for his symptoms and what he was going through. So the benefits are there, not just by the military. I believe it's been seen around the world. Whatever powers are there that be, I don't want to throw out conjecture and my own beliefs. There are hurdles that are keeping this at bay. So it's not just the military that I believe has admitted or seen benefit. I think the whole world has seen it. It's just a matter of getting to where we need to be so everybody has access to it.
And I think culturally, I know here in the United States, we are driven politically, unfortunately, by a lot of the pharma drugs, alcohol lobbies. We are getting lobbied into our treatments as opposed to listening to science, which I think is not necessarily the best way to go. So I think that's one of the things that's really slowed down the military from being able to really come out. But I know I'm very closely tied to a lot of the Israeli studies. I know the Israelis use cannabis, especially CBD, in military, or especially post-military actions to really help their soldiers. So it is recognized by some militaries. There has been a lot of studies, mostly done overseas. But I think we need to get our military in this country on board. I think they're slowly moving towards that, but it would be nice if they moved a little quicker. Is that safe to say, Manny?
I would say so. In my personal opinion, with the military and my background in it, I think it also comes down more to being able to regulate it, making sure that it's not abused.
Right.
You're talking about people who have weapons in their hands that have lives accountable. So we want to make sure that we're doing the right thing and ensuring that safety is always number one in our minds.
That's a good point. Um, it says next question is: even with all the medical benefits, is there a push or an effort to destigmatize medical cannabis or marijuana to the public? And the answer is there is a huge push going on right now. We have little groups like Normal, Safe, MPP, MMP, a lot of organizations doing lobbying. There's a lot of information going out there. I got involved in being able to provide more education on the product because the more education that gets out there, the more people really destigmatize marijuana. There's more going on now than has been in the past, but I think more has to be done. Your thoughts, Manny?
I concur. I completely agree. I've been in the industry now here in Florida since 2018. I've seen it come a long way, and every year, though it might be baby steps, we are progressing. And any and every step forward is always an improvement until we get to where we need to be.
Sure. I know that in the community I live in, when I first moved here 6 years ago, and I let people know I was in medical cannabis, you would have thought Darth Vader joined the community. Um, take this forward, where 284 people in our community got a medical marijuana card from MMTC. Can't walk into our local grocery store or in the clubhouse without being asked about it. I've become a stormtrooper, put it that way. So the answer is yeah, it's turning around, but it's clearly not there yet.
Well, we can always use everybody's help by word of mouth. That's how it starts. There's movements to get it on the ballot next year. So there's a lot of effort there. Anybody who's willing, let's shout it out. That's what I say.
Yeah, I mean, it's amazing how many times people ask me about if they hear I'm in medical cannabis, and the first thing they want to do is they want to know about it. It's great. So let's jump
Mhm.
into the questions that were brought up live that are here. First question, and Keith asked a great question: is the discount stackable? I think Forrest, you've been kind of quiet. You want to take that one on? How about you, Manny?
Yes, the
I believe.
discount is stackable.
Yep.
Yeah, good. The answer is yes. Susie asked a question. Manny, you can help us with this. Tell us about nanotechnology because you use nanotechnology in your products.
So nanotechnology, what that does is basically it's an envelope that carries the cannabinoid terpene profile, everything that it needs to get through the blood-brain barrier, or what we call our water filter in our body, to get into our system. Um, the reason they use nanotechnology again is because cannabis is a fatty molecule. It needs something fatty to attach to get into our system. So this helps bypass it. You'll see products that are enveloped, or like our relief drops, for instance, our 1 to 9 relief drops. You can put in water, 1 drop equals 1 milligram. You don't have to use fatty material in order to ingest it. You definitely don't want to put the relief drops directly under your tongue. Don't confuse it with the tincture, please. But that's what that means. And the reason that's important is because you also want to make sure you're getting this technology, or this envelope, if you will, from a dispensary like Surterra, where there's liability. Because if you're bypassing your water table and your water filter and everything else, you want to make sure what's in that envelope is pure and clean. Otherwise, it's very hard to get back out of your body since it already bypassed the filters.
But nanotechnology really helps the body absorb the product a lot better. And the answer is, it's something that take a look at. I think it can help quite a bit. And I think Soterra's done a great job of integrating it into their products.
Mhm.
So let's address Heather's question. I like the 1-to-1 ratio gummies with THC CBD, but it takes 7 to 12 milligrams for me to feel them. But then it lasts 4 to 5 hours, depending on my activity level, or or if I'm in more pain or not with at the time of initial dosing. If I use my vape with it, I notice I feel less anxiety from the edible and gummy for me personally. And again, that gets into the second question: should I not vape or take some when using the edibles or sublinguals? I go back to what I was mentioning earlier. Mixing and matching is good. I would say use the vape, especially if it helps relieve anxiety. Manny,
A
your
hun-
thoughts?
100%. You're right on the nail when you're using the vape as well as the gummy. The 7 to 12 milligrams, that's actually right in the range of the average dose for any given person. What I would ask, depending if it's the 1-to-1 ratio gummies want to choose, strawberry lemonade, those could be cut in half or in quarters, as previously mentioned. If you are using other chews, like the 5 milligram chews or gummies, and you're cutting those in half, I wouldn't suggest doing that because they're not homogenized, and you might be getting more medicine in one half than the other, or cutting yourself short either or. What I would suggest to get more benefit is, when, even though gummies are sublingual, if you're chewing them, try sucking on them. Get more sublingual absorption, more bioavailability under the tongue and through the mouth lining. And then also have a small snack, cup of yogurt, spoon of peanut butter, some avocado if you're down for that, or if you have other specific fats you like, or right before a big meal, take it. Then you might find more benefit, as there's not much fatty content in the gummy, just enough to carry it and suspend it. Having that in your gut as well, with some fatty material from ingesting ice cream, peanut butter, or fatty material, you might find more benefit and more efficiency that way.
Sure, sure. But again, cannabis likes fats, so that really helps quite a bit. And don't shy away from mixing and matching. I think that's something that can help quite a bit. I would say feel free to vape, especially if it can help that particular situation. Audrey asked a really good question: is there any long term or too much THC when it gets to a point to bring back memories? Now, let's talk about your therapeutic dose. If you get to a therapeutic dose, what's starting to work, you're feeling the relief, and then you go past that, will bring back, it will cause some negative effects and bring back some negative memories. So really the issue is, first of all, there's a couple of dimensions of this. One is dosing, and then I'll address the issue of too much THC. Let's talk about dosing first, Manny. I think this is, if you get your dosing correct, you find your therapeutic dosing level, this can help us quite a bit.
100%. So the dosing, or the biphasic effect, less is more. Once you find that sweet spot, as I call it, you want to hold back and sit right there, see how long that rides out. And usually it'll stay there, depending on your route of administration, for a little while. If you're inhaling, you might feel it for about 45 minutes to an hour and a half. If you take too much, typically you won't have the effect you're looking for anymore. No mitigation of your symptoms, no resolution of them, which then will give you agitation, aggravation, and compound on what you're going through. So then that becomes a negative effect. You can also take too much THC where it actually compounds on it, simply because it's actually making it worse, not just because you're getting frustrated.
Right.
So when it gets to the point of bringing back memories, it could be the cultivar, the strain you're using. It could be the dose you're using. Typically, going to be the dose, and you might want to dial back a little bit. Again, 7 to 12 milligrams average, about maybe a half a joint, depending on the strain or cultivar using in THC content. This is something, Audrey, we would love to sit down and discuss so we can actually see what product it is. If you're going from one product to another, that may be affecting it as well because your body's reacclimating. There's just so many variables, but low and slow would be the rule of thumb for me on this one. And then if you're not able to deal with those memories, try to talk it out with somebody that you trust or can confide in. That might help resolve it as well to where you can use that product a little bit more.
I think another option that is here is taking a cannabis holiday. I know that every 4 to 6 weeks, I will take a day or two off. I know they say the recommendation is to take 3 to 4 days off, but with herniated disc in my neck, if I go a day, maybe a day and a half, my neck taps my shoulder and says, "Better do something pretty quick, cowboy, or you're going to feel me." So taking a holiday, I think every 4 to 6 weeks will help be able to reset the receptors in your body, make THC more effective by taking less of it.
I
Your thoughts?
agree. And then you can even take mini holidays, day-to-day holidays by taking high CBD products or slapping on a patch for a day
Mhm.
that's high CBD to help mitigate that, specifically if you can't use high THC during the day because of your work activities or other activities you might be involved in.
Yeah, I know that when I had my knee operated, had a knee replacement, I was leaning more towards the THC because I was trying to manage pain. And what I found out was, as I started leaning more toward the CBD was relieving the inflammation, which was causing the pain. And so it actually turned out to be a better approach with higher CBD products and higher THC products for that particular, especially 2 months, 3 months after the operation. It really helped quite a bit. Right after the
Mhm.
operation, there's no question. I needed a higher THC product to manage the pain, but it really is something that, again, holidays will be something that can help. Great comment here. It says, I like to take a spoonful of peanut butter after my tincture. Does it matter before or after? Manny, your thoughts?
Not typically. I haven't had anybody come back and tell me specifically before or after. I usually say before just because I like to have the fat in there prior to myself taking the tincture or edible. But as long as it's right after and you're getting that content in there, it should be just fine. The other thing on sublinguals, if you're using a tincture and you're holding it under your tongue long enough, it's not going to make too much of an impactful difference that you'll notice. But most people don't hold it under their tongue long enough, or they don't chew on the gummy long enough. They just kind of chew it up and swallow it because it tastes good or any other reason. The longer you can hold that in your mouth under the tongue or even swish it around, the more bioavailability and the more absorption you get for
Mhm.
sublinguals. Now, when you're
Yeah.
taking our Theragels or chocolates and stuff like that, cookies or anything else from other dispensaries, then you definitely want to have something fatty in your belly, presumably, which is why you also see it in fatty materials such as cookies, chocolates, and so forth.
Yeah. Ideally, before would be the way to go. Ideally, but after doesn't hurt. You're not. There's no negative to doing that. Um, uh, Another question regarding gummies. I get very anxious and self-conscious even with indicas. Hybrids put me in a panic attack. Lately, I've been using a 10 milligram 2-to-1 gummy and still feel the anxiety magnified. 5 milligrams seems like I don't feel much change. Should I try a 4-to-1 or just add CBD capsules? I want the relaxation euphoria, but not the anxiety. Thank you very much. I think increasing the amount of CBD, like going to 4-to-1, would be a good approach. Your thoughts, Manny?
I can see that as well, or even depending again the terpene profile. If a one-to-one like soothe sounds like what I would recommend if you're looking for relaxation, euphoria, but not the anxiety. That sounds just like a description of soothe, but per
Right.
the ratios you're describing, it doesn't sound like it would be a viable option. So I would have to see what these gummies are, particularly if you're again cutting them in half or in quarters. If you're taking the whole gummy at 10 milligrams, which sounds like the wanna choose. The 5 milligrams sounds like our wellness line or our float line. Um, and it would be the time of day, the diet, but definitely increase the CBD to mitigate for now. And then if you would like to have a consultation, please stop by, give us a call at our customer care center. And we'd like to have that conversation so we can see what's going on there and learn ourselves as well.
Yeah. I think your point of the terpenes, it's not just a matter of, I think, heading in the direction of a higher CBD ratio would help. But I think pay attention to the terpenes because that could be one of the culprits here. By getting the right terpene profile can help quite a bit. I think you're right on with Manny with that particular advice. I would recommend a consultation. I think that it can't hurt, and all it's going to do is provide some information that can help provide not only a good answer but a path for the future to help you with your regime.
Hmm.
Um, your thoughts, Manny?
I agree. Get that consultation.
Yeah. Uh, Great question here. Any clue how much we can expect prices of medications to go up with the new laws passed? I'm not familiar with what they mean by new laws passed. I think they might mean some of the newer medical marijuana laws being passed, meaning more adult use coming out. I have seen prices over the last couple of years go down, not go up. And I think if you start seeing more products available on the market, as opposed to the pharma companies, I think there's more of a economic law of supply and demand in the cannabis market, where you'll probably see some products even go down because they'll be produced in higher quantities. Your thoughts, Manny?
There's mixed reviews as far as what I've seen from other states. I believe Florida leads the U.S. as far as the medicinal program, as far as efficiency and regulations, being that there has to be regulations.
Hmm.
But other states, when it goes medicinal and or recreational, that's when taxes get involved. And usually, if you have a medicinal card, you pay less taxes than the recreational. There may be a cap on THC percentages, if that can
Right.
even be mitigated, and the cost that would ensue. So honestly, I don't know what would happen with the new laws, and that's it again, like you said, Mark. If it's the new laws of it becoming recreational or getting on the ballot next year, there's so many things going on. I need a little bit more specificity to attack this question a little bit more.
Yeah, and I agree with that, but I do know that in states like Georgia, Texas, Alabama, where they're going to limit the amount of THC in the products, meaning the patient has to take more products, it's not a matter that the price goes up. It's a matter that you got to take more medication to get the same amount of relief. I think going in and regulating the amount of THC, which is a whole political move, not necessarily listening to the doctors, I think it's the wrong way to go. But at least they're going in the direction of providing medical marijuana. I would just like to have it be so that patients can get the amount of medication they need without it double dipping and triple dipping to get there. And I think that's what they're referring to it as well.
Yeah.
Um, Another question, good question, is can certain terpenes help PTS symptoms more than others? I think you addressed that, Manny.
100% definitely. I believe that when it comes to PTS and diagnosed PTSD, terpenes play a huge role, probably more so than the cannabinoids or THC percentage. For me, I'm a hybrid sativa guy, so I love that alpha pinene and limonene, whereas most or others cannot tolerate it because of the anxiety and the things they bring back on. So the terpenes that most would go to, as you see on your screen, myrcene at the top. It has a little cousin called linalool that's usually paired up with him. Excuse me. And then you have limonene that's usually paired up with alpha pinene, and then caryophyllene. More than likely, the myrcene with caryophyllene is the route you're going to want to go. However, be cautious that alpha pinene and limonene can create that anxiety. And as you see in that little note at the bottom, my go-to ones that I like to recommend to start off as a recommendation for patients is Serene 5-to-1. That's more of your daytime use, and then your Soothe 1-to-1, which could be anytime, but typically your early afternoon to early evening time frame before you'd switch to a higher THC product like Dream 1-to-9.
That's a good point. Anthony asked a question: are there classes to learn more about terpenes and what fits for me? First of all, I do a video and a webinar on terpenes. Please go to the YouTube channel and look at that terpene video as well as the webinar. There's a lot of questions and answers at the end of that can help. Also, I think that when you're looking at terpenes, it's very hard to find a lot of information on it because it's not as popular a subject. But I do think that our YouTube channel can help quite a bit. Get that video that's there. It's marijuana aware. Is YouTube HTTP marijuana YouTube /marijuana aware can help quite a bit. As far as other classes that to go to, I think that you're going to find that I know that you at Surterra have been conducting classes on Sundays on terpenes. Is that correct, Manny?
Last month we had terpenes. This month is on our wellness line. However, you're more than welcome to come in and we'll have a little mini one-on-one class with you and kind of give you the scoop. Probably give you some resources where you could dive in a little bit more, just like marijuana aware and the webinars we're doing here. Um, Also, my tip would be if or when you do dive into classes or books, don't look at terpenes as singular. You want to look at terpenes more like a recipe where you have a few, if not a multitude of terpenes that make up a specific recipe or profile for a specific effect, not just one or two terpenes. Now we're listing four here because those are the top ones because they're in a small variety but very potent. But there's more that go into it than just that. This is where you want to look to get started.
Right. Yeah. I think there's a lot of research that's been done on the individual terpenes. Classes are a different subject. I have really not found a lot of them. I know there are companies like True Terpenes that specialize in terpenes that have good information, but they really break it down by the individual terpenes that are out there. So, um, unfortunately, there's not a lot of good material on that. That's why I spend a lot of time providing that information because it's hard to find, to be candid with you, and find good, accurate information is really, really important. Um, Let's move on to the next question. It says, I'm having an operation in a week. Should I stop all marijuana before and what time frame after operation I will be on oxycodone for 7 days? What is the consequences of taking both? Um, when I had my left knee replacement, and I'm talking to my medical cannabis doctor and my medical doctor, I stopped using cannabis approximately a week, almost 10 days prior to the operation, uh, just to be safe. It wasn't a matter of the operation itself. It had a lot to do with the anesthesia. I talked to my anesthesiologist about it, and he really felt better with me not using medical cannabis. Now, after the operation, I was prescribed Percocet, and I actually stopped taking Percocet the third day after the operation. They gave me plenty of Percocet to last for months, um, but I found that medical cannabis worked much better than the Percocet to being able to relieve the pain and the inflammation. I don't recommend high doses of oxycodone and medical cannabis. I would wean off of the oxycodone after a period of maybe 2 to 3 weeks and go almost all medical cannabis. I think that oxycodone itself really shouldn't be used for more than 2 weeks anyway. Your thoughts on that, Manny?
Yes, we don't give that type of medical advice. However, we do know because especially in Pensacola, being surrounded by the hospitals, that physicians will say, particularly CBD, believe it or not to take pre or post surgery. And for some of the reasons is that blood thinners being administered during surgery, that CBD can help as a diuretic and help drop that blood pressure, which they don't want during surgery. But we will always tell you follow your physician's advice. We will advise you on products to take for pain, but we won't tell you when or what to stop as far as a prescription. It's just not our wheelhouse. And we
Yeah,
definitely don't want to take that liability, not being medical
yeah.
professionals.
But oxycodone was really never designed to be taken for more than 2 weeks. That's why this whole thing that came out was really not good for anybody's body. I would recommend that after 3 or 4 days, and candidly, definitely after 2 weeks, I would transition over to medical cannabis or a less severe pain medication that's really out there. As I mentioned, I was able to with a left knee replacement, which is very high in pain. I was able to start after the third day, and after 2 weeks, I really had my pain level down to less than a one. In fact, candidly, after about 4 days, I had my pain level down to a one by managing it correctly. So it's something that's there. Anthony asked a good question. How do you lower tolerance? I feel that if I do edibles, I need at least 200 milligrams, or I don't feel much. I'm able to find that in Vegas, but not here. I think first of all, lowering your tolerance has to do with taking a holiday. Manny, you and I will talk about that in just a second. But I also think a lot of this, when you talk about how much you take, what you're looking for is, I don't know what the relief you're looking for. I don't know if you're looking for relief from pain, anxiety, PTS. I don't know what you're looking for, but I think really paying attention to the terpenes is really important here. Your thoughts, Manny?
I agree 100%. Now, here's the funny part on that. When you're dealing with edibles, typically since terpenes are the most volatile molecule on the plant, when you ingest it, as soon as it hits the stomach acid, those terpenes are gone, they're lost. So you lose the direction of the effect that you were seeking with that terpene infusion. which is why I tell people try to hold it under the tongue or in their mouths as long as possible. Again, then you also want to look at the diet. If it's the Nerds candy ropes, if it's these weird sugar candies, they're not as efficient for absorption because there's no fatty material there with it to carry it in. So 2000 milligrams is a significant dose. It's not unheard of. I don't want you to think that you're going to be ostracized because you're taking that many. You may be dealing with something that you can only understand. However, check the diet, come in for a consultation. It could be simply the type of product you're taking or how you're administering it that you're not getting the most efficacy or efficiency out of that product.
Yeah. If you're taking a product that doesn't really have the right terpene profile, taking more of it's not going to help. But
Correct.
let's just find out let's just dial in what you need and then make sure we home in on that. I think that'll help quite a bit here. Marissa asked, the next question is, I have too much of apparently the wrong products. I've been trying over the years, sativas, hybrids, indicas, all induce severe anxiety, many tinctures and gummies. What can I do with these products if I'm not going to consume them? Also, what are the main terpenes again to look for regarding relaxing effects? Manny, this is a good question. I think this right up your alley.
Absolutely. Keeping me on my toes here. So this typically happens when you're not getting the right information and you're really trying to find something that's going to help, and you start stocking up all these products. I tell customers when they come in and if they have this issue, come back and write down what you have. Don't bring your medicine with you, please. We can't have it all in the dispensary, but write down what you have, where you got it from, bring it in, and we'll kind of help figure out if you can reuse those in a different manner. As far as the different terpenes that we were talking about, you're gonna want to look for myrcene and or linalool as your top two for more relaxing and or sedative effects, and it'll definitely help with spasticity as well. I'd like to recommend myrcene with caryophyllene. That way you have the spasticity, the pain relief if you're dealing with that, as well as the relaxation, and a slight euphoric effect, if not a very heavy euphoric effect, depending on time of day or what you're trying to achieve. But we could talk to you about what products you have and possibly show you how to reuse those in a different manner that'll be beneficial to you. No
I think
promises.
that this is where a consultation is really, really important to be able to really get to the bottom line, to the bottom of this. Um, Keith asked a question: if you change the route of administration, it also helps, just like a vacation or a holiday. Also, if you change the THC level on the CBD back and forth, what will cause a holiday will likely affect will will like will cause a vacation like effect. Will it not? It does help for me. I think changing the CBD and THC levels really can really help you hone in on, candidly, your therapeutic dosing level and really what the right products are.
100%. I'm actually really liking this one, Keith. Thank you for commenting on that. So, what I recommend for patients, particularly if you're dealing with high THC products, is your body's going to become tolerant to that product. It's going to get used to that product where it won't be as efficient and possibly not as effective. So, that's why it's important to know your terpene profile or that terpene profile so we can show you another product that's comparable to reintroduce to your body that's going to keep your body guessing and make it feel as if it was the first time you were using that product with such great efficacy. Increasing or mitigating your CBD and THC doses will do the same thing as well, Keith. So that's a great point out or a great call out. And it does treat your body as a vacation or a tolerance break is the technical term. So your body's like, oh, this is new. I'm going to try this and make the best use of this. And then it's like, okay, I don't want to use that anymore. That's boring. And you switch over to something else, just like our diets and our appetites. My wife loved Thai food for so long, and now I can't even look at Thai food after loving it for so long because we had it so much. We switched to something else, and then maybe we'll reintroduce Thai food in a month or two.
Sure, sure. Really, I think again, trying different products, different routes of administration, and different products really can help quite a bit. And that's a really good point. Keith, thank you for bringing up this particular question. That's really there. Now, next question is Anthony. That's exactly what I need help with, terpene recipes. Anthony, please do a consultation. Terpenes are really critical to really getting the main benefits. I'm doing a lot of work on terpenes right now and hope to introduce a process and a product within the next couple of months that can help in this area. But the point is, knowing which terpenes address your particular medical condition and getting products that match that really is the key to medical cannabis. So I think that's really that's there. Ryan asked a question: do certain products, tinctures, edibles, RSO, make your tolerance go up more so that others go up more so that others, such as inhalation? I think what you're talking about here is each product, like a tincture, edible, RSO, which falls into a tincture type of product, or inhalation, they have what they call an onset. How long does it take to work? Things like smokables or flower concentrates, vape pens work almost immediately. Same thing with uh, uh, topicals; they work almost immediately. But when you take a look at one of the things you got to be careful of is with edibles. When you take that edible can take sometimes up to 2 hours to work. It can take an hour and a half to 2 hours to work, and that's really the issue. People take the product, goes 30 minutes, 40 minutes, it's not working, so they take it again rather than waiting that hour and a half to 2 hours. So really, when it talks about your tolerance and you're talking about what really works for you, understand the onset time and the duration time, and then really stick to those, because you really don't want to get yourself into a situation where you're taking too much of it because you didn't wait long. Your thoughts, Manny?
I agree on that one. To go a little bit further, it's also going to be dependent upon frequency. So
Mhm.
if you're taking RSO, particularly, that's a very potent and very high THC product. Well, it's more than likely is there are CBD RSOs out there, or FSOs as we call it, full spectrum oil. If you're taking it more frequently, your tolerance is going to go up, particularly if you're not taking something like CBD 1 to 1 or a higher ratio CBD to help mitigate that effect of THC over inundating your CB1 and CB2 receptors. So you want to make sure that you take that with caution. The biggest one that I will say that makes your tolerance go up more than anything else are using concentrates at high temperatures to achieve THCV. And also keep in mind certain THCs like Delta 9 and 11 hydroxy, THCV, CBD, and all these other cannabinoids, some cancel out others depending on how you're taking them. So again, that's why that consultation is very important. Make sure that if you're getting a certain product, that you know the most efficient and effective way to take it to benefit your symptoms.
Yeah. And I do want to point out the consultations are free. So it's really worth doing. And not really, I think it's something that whether you're, again, whether you're experienced at medical cannabis or you're a newcomer, really, I'd recommend a consultation. Manny, we've covered a lot of topics. This has been a long webinar. There's a lot of resources to take a look at that people have at their disposal. First of all, if you're looking at getting a card, um, I recommend Medical Marijuana Treatment Clinics of Florida. There's 25 locations throughout Florida. They also have locations in Ohio and in Mississippi that can help quite a bit, and they're going to be opening up in other states as well. But this is a group that has professional doctors. They do a lot of training, and more importantly, they have dosing support as part of the program that they offer for you, which I think is important. Also, I recommend Surterra. Obviously, I've been a fan of Surterra products long before these webinars. I think I started out with Surterra, and I've just find the ratio of products, the products that are there are really good. If you're looking at just a CBD product or a full rate spectrum product, My Botanical Wellness is available to you. That's an online site that we put together. We've had doctors and physicians recommend and look for CBD products because it's an unregulated market, and we want to make sure we have safe products for patients that are out there. And of course, not last but not least is our YouTube channel. It's been put together to really help you be able to understand what products work best for you, how to take it, and more importantly, get answers to a lot of your questions. That's why it's broken down into by product or by condition, the videos themselves, and then the answers and questions and answers that are out there. So, really, thank you very much for that information, Manny. We've covered a lot of topics. Any final thoughts?
Just in closing, I'd like to say thank you, Mark, for having me again. I always love sharing my story and sharing knowledge. For all those who attended, thank you for your time. And I just want to let you know, please visit Surterra.com. We have a lot of resources there, digital journals that you could download to help you track your journey, as well as informational blogs. Thank you again. I hope everybody learned something.
You really, if you're suffering from PTS, and you have a loved one suffering from PTS, I don't think too much information is a bad thing. Anything that can help them get their life back, I think, is really, really important. So, any final thoughts you have? You have, Forrest?
No, I agree with everything Manny said. We got a lot of great resources, a lot of journals, things like that. Have consultations, really go in, talk to our staff. They're all trained like what you're hearing Manny talk about tonight. So no matter where you are in the state, go and talk to somebody and we can definitely help.
Great. Well, listen, I want to thank everybody who still is on this webinar. I know it's a long webinar, but a lot of information. As a follow-up, you will get an email that has a link to the video itself, not only the video, but also the webinar. It'll give you a copy of the slides. It'll give you a lot of the charts and things that you've seen. You'll have copies of that, and more importantly, scheduled for next time. So we will have a follow-up that's coming out. I want to give a special thanks to some folks in the background, Lee and Leah, that really helped make this thing happen and drive this. They've been very, very helpful. Alyssa Quintera, who is actually the person who came up with the idea of this webinar, is important. And more importantly, everyone who has joined us tonight, I think it's really important to really feel comfortable that if you have a situation where you have PTS from a traumatic event, you're not alone, and there is something that can really help you quite a bit. Thank you, everybody, and more importantly, for Manny and Forrest, thank you very much for your support.